Good morning, good afternoon, wherever you are in the world. This is a presentation by Veronica A. Fortu. I am an RN case manager, hospice department, working with Kaiser Permanente, Washington. The use of acupuncture for pain management. The purpose of this presentation is to analyze the use of acupuncture presented by Makosi 2015 in chapter 29 of his book Fundamentals of Complementary and Alternative Medicine as Chinese Cultural Practice in the Treatment of Pain in a Patient with Small Cell Neuroendocrine Carcinoma with Mets to Brain, Liver, Lung, intrahepatic bile duct, right and left adrenal glands, and how Kokaba's theory of comfort mirrors this very popular Chinese practice and its impact on the U.S. healthcare practice while respecting patients' treatment preferences. Description of acupuncture. Acupuncture is one of the practices used in traditional Chinese medicine. It is a technique in which practitioners stimulate specific points on the body, most often by inserting needles through the skin. NCCIH 2016 says that. Global ethno-medical system. Ethno-medicine is a term that refers to a wide range of healthcare systems, structures, practices, beliefs, and therapeutic techniques that arise from indigenous cultural development. Ethno-medical systems tend to see the mind and body as one entity, and they focus on preventive techniques such as use of massage therapy, exercise, spices, herbs, and food to heal a disease or ill individual. In any case, many forms of Eastern medicine, such as traditional Chinese medicine, are examples of ethnomedicine. This means techniques like herbal therapy, acupressure, acupuncture are some well-known practical examples of ethnomedicine as well. This is according to study.com 2018. Issues addressed by acupuncture. Mr. Lee is our patient here. It was quite interesting when I met him, and his granddaughter is a master. She's mastered some Japanese, Chinese traditional medicine. Mr. Lee's goal is comfort only. He has elected not to continue chemo, no radiation in his home on hospice, and he just wants to be comfortable. So Mr. Lee is an 88-year-old Chinese native male who presents with severe pain to his head and lower extremity related to the diagnosis of small cell neuroendocrine carcinoma with Mets to brain, liver, lung, intrahepatic bile duct, right and left adrenal glands. He's using acupuncture to relieve pain and provide comfort. In his case, when I gathered, the doctor was holding his head and holding and working some spiritual things on him for him to relax. So acupuncture is used mainly to relieve discomfort associated with a variety of diseases and conditions, including chemotherapy, induced and post-operative nausea and vomiting, dental pain, headaches, including tension headaches and migraines, labor pain, lower back pain, neck pain, osteoarthritis, menstrual cramps, respiratory disorders such as allergic rhinitis. Mayo.com. Describe and apply a nursing theory or model. Mr. Lee's goal is comfort. As we mentioned before, he does not want to be in pain at all. And Catherine Kokaber's theory of comfort mirrors this very Chinese traditional practice. Kohaber's theory of comfort was first developed in the 1990s. Kohaber described comfort existing in three forms: relief, ease, and transcendence. If specific comfort needs of a patient are met, the patient experiences comfort in the sense of relief. Peptide Print 2016. The theory is patient-centered with easy integration of comfort practices which are derived from collaborative planning that recognizes the patient's culture and spiritual practices. Cook-Harvard, Catherine 2000. Cultural and spiritual assessment. Mr. Lee, as we mentioned, is from China and is very attached to his traditional religion. The goal of the hospice nurse and team is to preserve his tradition and what it means to him. Traditional Chinese medicine was intertwined with wisdom. It was holistic medicine at its finest, believing in the mind-body connection. It utilized all aspects of wisdom, combining healing on many aspects from spiritual, mental, physical, and emotional. Zach 2004. What can be done to achieve optimal outcomes? The hospice team is fully aware of patients' culture and has implemented a plan in place to accommodate that aspect, which means the patient is allowed to implement and use his Chinese traditional treatment of acupuncture and other Chinese treatment as well. And hospice is going to come in PRN with conventional medicine when his treatment fails or when so the patient has a choice and it's open to him whenever he thinks that his treatment is not responding to his condition anymore. Hospice is there to help him. So practitioners across the world and US need to educate themselves on the global ethno-medical system, including acupuncture, respecting the patient's traditional beliefs and their spirituality. And this how does this impact advanced nursing practice? Regardless of the limitations of this practice of this Chinese traditional medicine, it is very important to have an understanding of diverse cultural healthcare beliefs when treating individuals of different ethnic backgrounds. A study by Mulady, Mecham, and Schley 2009 showcases the increasingly complex and multi-system based medical treatments being used internationally. As the US incorporates more ethno-medical therapies into the Western medical care of global community members, we must seek a better understanding of diverse healthcare systems and the cultures that support such systems. Healthcare references and thank you for your time. Questions are welcome. God bless you.